The main driver of growth in Lagos over the past 50 years has been rural-urban migration. And that is because the city of Lagos is a land of opportunities with great potentials for all and sundry. No doubt, Lagos is indeed a city of choice. Let's talk about Lagos once again on the City of Lagos TV show. The show will begin in a moment. Welcome to Lagos Update on the City of Lagos TV show on TV Nigeria. It's time to keep you abreast with latest news update in and around Lagos. We'll be right back. First on Lagos Update, the Honorable Commissioner for Fiscal Planning and Urban Development, Dr. Oluyinka Olumide, recently announced a one-week stakeholders meeting to discuss key fundamental issues in the building industry at a press conference in Lagos. The stakeholders expected of the engagement spanned from professionals in the built environment to town planners, architects, estate surveyors, and developers. The commissioner stated the rationale behind the stakeholders' engagement and equally made clarifications on questions raised from the pressman as regards regulatory procedures and requirements with respect to acquiring land and building structures in Lagos State.
The whole idea is for us to sit down together and jointly examine what are the challenges. A lot of people, even the market women, majority of them are not yet aware of the importance of planning permits. So those are the reasons why we decided to engage on this stakeholders meeting for the whole of this week. And there is going to be a lot of other exercises that will come up as a way of going down to the grassroots to let them understand the importance of planning permits. Even ordinary fence, you are expected to have a fencing permit. That is by law, number one. Number two is the fact that in case there is a need for government in future, like expansion of roads, new roads, if that particular building does not have a planning permit, that means it is not recognized by law, in which case compensation might not be possible. Planning permit is also very, very essential because if, for example, there is a need for you to talk about, let's say you are applying for a visa or you are applying for a facility from a bank and there is a need for you to present your landed property, documents for your landed property. If you present such and it does not have a planning permit, it's not going to be accepted because the meaning is that that development is not recognized by law. It's very, very, very important. Regarding the details for this approval, it is very, very simple. The very first thing you need to do is to marshal your team of consultants. In most cases, they start with the architect and you submit your survey. Upon the completion of that architectural drawing, that is architectural drawing, you still have other drawings that will be required. In this case, you have the structural engineering drawing for which a civil engineer will produce that. So having gotten all your drawings together, you now approach the district office and we have 57 of them all over Lagos, the local government and LCD all over Lagos. So it's not necessarily you come to head office or to the secretariat. You go to your nearest district office. They will give you an assessment that this is what you are expected to pay. You go to your bank of your choice and you make your payment. You will now go back to the district office with the receipt of your payment. What we've seen as a challenge at this point is the fact that, and you will agree with me, you must be a tax-paying citizen. Then you must show your evidence of tax payment. This is what we will have because majority of people who are trying to apply for planning permits are not paying taxes.
And of course, finally on Lagos updates, the recently held Nigeria State Level ART Impact Survey, Lagos State Press Conference, saw various key strategic stakeholders in attendance, and the occasion was a veritable platform for the Lagos State Ministry of Health, an ample opportunity to brief the media and critical stakeholders about the progress made so far to ensure a successful execution. Representing the Lagos State Ministry of Health was the Permanent Secretary who gave account of the ministry's strategic master plan to achieve its set objectives.
On behalf of the Lagos State Ministry of Health, I am pleased to brief you on the Nigeria State Level Antiretroviral Therapy Impact Survey, the AIS, in Lagos State. The survey is a significant health initiative aimed at improving the well-being of the people of Lagos State. The Antiretroviral Impact Survey is designed to assess the effectiveness of the HIV and AIDS response in Lagos State. The data collected will help us understand three key outcomes. One, the number of people living with HIV who have been identified. How many of these identified are receiving life-saving antiretroviral treatment? And then thirdly, among those on treatment, how many have achieved viral suppression, meaning the amount of HIV in their blood is so low that they cannot transmit the virus to others. It's important to note that the main goal of HIV treatment is to reduce the amount of virus in the body to such a level that it cannot be passed on to other people. The objective of the survey is in twofold: to measure population-based HIV treatment coverage, which involves assessing the proportion of individuals living with HIV who are receiving life-saving antiretroviral therapy, and to determine the prevalence of viral load suppression. This will help us understand the percentage of individuals on HIV treatment who have achieved viral load suppression. In short, the effectiveness of the therapy that we're giving. The data collected will provide valuable insights that will inform our health policies and strategies to enhance HIV testing, treatment, and care services in Lagos State. The ART survey will provide information on the current levels of treatment coverage and viral load suppression and help identify gaps and areas that need improvement. The survey will help in identifying systemic challenges and opportunities for strengthening our health systems to better support individuals living with HIV. The survey will help us to understand biobehavioral patterns and factors associated with HIV virus suppression in people living with HIV who are on ART to strengthen support services. How will this survey be implemented? The survey will be conducted between October and December 2025. During the survey, only males and females who are between the ages of 15 to 64 years will be interviewed. The survey will be conducted in about 6,150 households across all the 20 LGAs in the state, during which approximately 11,354 people will be interviewed. Our trained field teams, comprised of healthcare professionals, will visit households to collect information through interviews. The teams will offer HIV counseling and testing with rapid test kits, and the test results will be provided before the team leaves the house. We assure you that all data collection and analysis will be done with the utmost respect for the privacy of all participants. Information collected during the interview will be kept confidential, and anyone who tests positive for the first time during this activity will also be referred to care. Community engagement. Community mobilization and engagement are key components of this survey. We have been working closely with community leaders, civil society organizations, and other stakeholders to ensure that our communities are well informed about the service objectives and benefits it will bring to our people. We encourage all residents to participate in the survey if asked. However, we respect your decision if you choose not to be a part of this. If you agree to participate, it will take approximately 45 minutes for the interview and the blood sample collection for HIV testing. The ART Impact Survey is supported by our partners, including the Federal Government of Nigeria, Federal Ministry of Health and Social Welfare, the United States President's Emergency Plan for AIDS Relief, PEPFAR, Public Health Information Surveillance Solution Systems, FIS3, and various subject matter experts.
And that's a wrap on Lagos Update this week. Do care to join us on the City of Lagos TV show for more news update on Lagos Update. Next is from the Governor's Office platform on the City of Lagos TV show. We'll be right back. Offering good governance for Governor Babajide Sanwo-Olu is usually a serious business. This is evident in Mr. Governor's recent official engagements. So let's keep you posted from the Governor's Office platform on the City of Lagos TV show on TV Nigeria about recent official engagements of Mr. Governor. We'll be right back. The Lagos State Governor, Mr. Babajide Sanwo-Olu, at the recently held Nigerian Institute of International Affairs NIA Distinguished Lecture Series held in Lagos with the theme Lagos and Nigeria 2030 Projections of a World Power, gave a thought-provoking and reassuring speech about the great futuristic goals and aspirations of Lagos as a city-state destined to become Africa's model city and a global economic financial hub that is safe, secure, functional, and productive. Mr. Governor will describe the theme of the event as apt and timely, noted that the Lagos vision is anchored on 4 critical pillars.
Lagos and Nigeria 2030, projection of a world power. I found this theme especially inspiring, given how it readily acknowledges the very strong interconnection between Lagos and Nigeria, and the fact that there is no future version of Nigeria that would not be deeply shaped and impacted by Lagos. The concept of Nigeria 2030 brings to mind a series of national and international visions. On the domestic scene, we've seen Vision 2010. It came to mind. It was followed by Vision 2020, and then Nigerian Agenda 2050, which was launched by the last administration in 2023. They all seek to place Nigeria amongst world-leading middle-income economies by 2050. And upon the assumption of office, my leader, my president, President Bola Ahmed Tinubu, GCFR, declared a goal of making Nigeria a $1 trillion economy by 2030. You can see Nigeria's commitment to Paris Climate Agreement. We believe it's envisioned, and we said that we will end gas flaring by 2030, while also generating a third of our electricity from renewable sources. And so you can see different dimensions of Nigeria's vision. However, at the subnational level, we have the Lagos State Development Plan 2052, which is our own 30-year development plan that was launched in year 2022. It was eloquently articulated our current administration's ambition to become Africa's model megacity and a global economic financial hub that is safe, that is secure, it's functional and productive. So it's a mouthful ambition that we have driven and we have casted for Lagos State. The Lagos State 30-year plan has been anchored on 4 critical pillars. We want to build a thriving economy. We want to have modern infrastructure in all facets. We want to have a human-centric city in which all the global players in the world will think of a location where they can resource 500,000 tech experts. Think of Lagos.
Earlier in his opening remark, the Director General of the Nigerian Institute of International Affairs, Professor Ehosa Osage, described the greatness, potentials, unique capabilities, and strength of Lagos as a local and international brand city, using verifiable parameters to drive home his message.
There are very few world powers, and Lagos ranks very high on that list. Today, with a population in excess of 22 million, Lagos qualifies and has the merit of being Africa's growth center. Lagos is unparalleled in Africa, and you will soon see why. But let me just tell us a few things. There are 5 cities in the world that are called Lagos. 3 are very prominent. One is in Portugal, another is in Greece. There is one that has an alliance in Benin Republic next door to us. And in the Philippines, you also have a Lagos. But of all these 5, the one that gives all the others the bearing that they have is Eko, our own Lagos. Lagos is also the foundation of Nigeria's judiciary. And one of the reasons we have Lagos so vibrant is the strength of its judiciary. Think what Lagos has also done in the last couple of years. Lagos pioneered the alternative dispute resolution mechanisms, the multi-court house. That's Lagos. Lagos also introduced special offenses, including sex offenses courts. That is second to none. So, if you've been thinking of an effective judicial system, Lagos has led the way. Nigeria's civil society has found its place in Lagos. Think of all of the activists, all of the guys that drove Nigeria's democratization process. All those who pioneered those things and laid down their lives and made those unbelievable sacrifices. They were all in Lagos. But Lagos is a heartbeat for something else that you haven't considered. It's not just the commercial capital of Africa. It's a commercial hub for the entire universe of humanity. The Nigerian private sector, which has taken the world by storm, is Lagos-based. Think of all the great names in our private sector. All of those people that are making the world different, from the refineries that have been established, to the entrepreneurial drives that they have had, to the big banks that, the systems that run African finances come from Nigerian banks, and they all come from Lagos. So, Lagos is the heartbeat that a global power has. But most of all, Lagos has been the most blessed of all old states in Nigeria with the best forms of leadership. I'm sure that if you count back and look at what Lagos has achieved over the years, you cannot but recognize that at the core of all that Lagos has achieved is good leadership.
The Lagos State Governor, Mr. Babajide Sanwo-Olu, at the first Lagos State Waterfront Summit, organized by the Ministry of Waterfront and Infrastructural Development, described the gathering as strategic to confront one of the greatest environmental and socio-economic challenges of our time. The governor gave his first-hand experience at the challenges and preferred solution-driven strategies.
The gathering, in my view, is historic. It's also very necessary. And it's urgent because it's a come together, and you've seen from all the speakers, to confront one of the greatest environmental and social economic challenges of our time: the preservation and the sustainability management of our lagoon and waterways. The Lagos Lagoon is central to our ecosystem, providing essential support to countless communities. All of my traditional rulers, all of them, they have their kingdom all by the water, and acting as an economic lifeline for millions. It is a vital link to our past, it's a critical link of our culture and the future we're building together. This invaluable natural treasure is facing serious threats. Dr. Banire has said it, the last speaker had said it. We've seen issues of illegal dredging, unregulated sand mining, reckless land reclamation, abandon and shipwrecks, marine pollution, and unchecked urban growth are all taking toll on the well-being of our lagoon. Climate change is making this worse. It's leading to flooding and coastal surges that displaces the entire communities and erodes our shorelines. I stand here with my heart bleeding, quite frankly, that indeed we have a problem, and it's something that each and every one of us can rise up to help to solve. A few weeks ago, I visited the coastline, Ibeshe, to Ilashe, to Inagbe, all on the coastal communities, and the reports are out there in the papers. And it represents both the promise and the challenges of our waterfront. We saw huge opportunity, huge commercial opportunity, but we also saw challenges on that trip. I met with residents, I listened to their concerns, and I saw firsthand the struggles they face daily, the homes at risk of erosion, livelihood that has been disrupted by flooding, and infrastructure that has not kept pace with the needs of a growing population. Those visits reminded me that behind every statistics, real people whose hopes and future depends on the decision we all make today. Perhaps one of the simplest examples of those challenges is in a village called Idotun, a once thriving coastal community, now almost completely swept away by the unforgiven waves of the Atlantic. This is the human face of coastal erosion, and it's a wake-up call that we must act urgently and decisively so. Recent global reports highlighted that more than 80% of the shoreline of Lagos are being threatened in the next 50 years. And I think it speaks to the reality of what we're also saying today.
Earlier in his speech, the Commissioner of the Ministry, Honorable Yakub Ekundayo Alebiosu, submitted that the earlier practical steps are taken to address the degradation of the coastal lines, the better for the city.
Water. It is life, culture, economy, and certainly identity. Yet today, it faces mounting pressure from pollution, unchecked urbanization, and climate change. We have all witnessed how some coastal communities, like Idotun village, have been swept away, and we know that if nothing is done, more communities, livelihoods, and opportunities will be lost. We must also confront the growing challenge of illegal dredging that is weakening our shorelines, altering the natural flow of the lagoon.
The Lagos State Governor, Mr. Babajide Sanwo-Olu, reiterated the need for the state government to raise and deepen the bond market in order to have the financial capacity to fast-track development and address fundamental projects critical to sustain the Things Plus developmental agenda of his administration. Mr. Governor raised fundamental goals and certain parameters to ensure that the Lagos bonds are oversubscribed. Governor Sanwo-Olu bared his mind at a recent forum in Lagos with investors, targeting and focusing on the Series 2 green bonds and Series 4 bond issuance.
This is the most important meeting and engagement that I need to have, because this one signals, how we do or don't do well at the end of the day. Because it's really around what level of development we can throw back into our system. And what does the first slide shows? We're doing Series 2 green bonds and Series 4, bond issuance, under some of these things. And I will honestly speak to the challenges that we have. And so when BB said that we're raising the bar and we're breaking records, believe me, these are no records again. Because even before we raise this money, Roosevelt was with me the other day, it's been spent. It's not close to what we require at all. And all of us need to be very critical about this and look at your own balance sheet 4 or 5 years ago and where it is now. And so if you can extrapolate and see the volume of business, the numbers you are doing, post-COVID, from 2019 now to 2025, how you have tripled and you have quadrupled whatever numbers in all of these spheres, right? It speaks that even for us on the public sector side, we need to do 10 times because we're 5-8 times behind schedule. All of our infrastructure, each year on year, we said we need to do, some numbers that we are actually running behind schedule. Now add the challenges of the reality of the numbers and the figures we're dealing with now, and to have everything we have to be repriced. So when they said that we're doing 3 trillion, so we'll see it in dollar terms. How much is that? So it's like going back to where we were in 2019 or 2020. So indeed, if we live here believing that the budget of Lagos by next year should be about 8 to 10 trillion, then we're beginning to talk. If you now see that the entire series of 1 trillion should be what this market should be able to help us raise at once, then we're talking.
Earlier in his speech, Lagos State Honorable Commissioner for Finance, Abayomi Oluyomi, noted the spectacular performance and advantages of investing in Lagos bonds and factors responsible for its success so far.
Lagos is not a stranger to bonds because, of course, we were the first subnational to issue a revenue bond in Nigeria, a 30 million bond issued in 1987 to fund the Lekki Peninsula Scheme 1. Lagos today, and at this current time, is also setting 2 additional records. One, as the first subnational government in Nigeria to issue green bond, and also to issue the largest single series of conventional bond, which we said is 200 billion. So those 2 records are being set by Lagos as well. The Lekki corridor today is becoming an economic powerhouse, not only of Lagos State, but also in the sub-Saharan Africa. A clear reminder of what is possible when financing is done right. Over the years, we have successfully raised funds through bonds and other mechanisms and channeled them into landmark projects, such as the Lekki Deep Seaport, the Blue and Red Line project, the Ikeja bus terminal, the affordable houses, and of course, different food hubs that we have across the state. The financial world is shifting towards impact-driven investments, and Lagos cannot afford to be left behind. Investors are no longer just looking at returns. They want to see social impact, environmental sustainability, and long-term development. Within the Lagos State financial ecosystem, social and diaspora bond with environmental impact bonds are dominating the current conversation and our current initiatives. Lagos is a city of possibilities. We have shown time and time again that with visionary leadership, strategic planning, and disciplined execution, we can transform financial limitations into opportunities.
And still from the governor's office, the Lagos State Governor, Mr. Babajide Sanwo-Olu, celebrated the 2025 International Youth Week with the youths in Lagos in a grand style. The governor, while admonishing the youths to transform the state and the nation in their various fields of endeavor, noted the great potentials of the youths as great assets to the state and the country. He equally highlighted various efforts and initiatives of his government to position and empower the youths in Lagos State.
I'm truly excited to be here with you today. The 2025 National Youth Day Summit is a yearly event which is being organized by the Lagos State Ministry of Youth and Social Development. This event, it aligns perfectly with the global celebration of the young people who are undeniably the driving force behind growth, behind innovation, and certainly are the driving force behind progress. This year's theme, Local Youth Action for the Sustainable Development Goals and Beyond, is incredibly motivating. It highlights the vital role our youth plays, not just as reaching the sustainable goals requirement, but also in shaping the future of our society by the year 2030. In Lagos, we firmly believe that the young people are the leaders of today and tomorrow. Your creativity, your resilience, and innovation are essential for the growth of our state and our nation. That is why under our Teams Plus agenda, we have made youth empowerment, social inclusion as a priority in our government. We have rolled out, supported various youth initiative programs that we believe have uplifted the youth organization. We are doing the Amplifying Business Clinic and the pitch contest, which some of you are going to be walking away here with support. This contest has offered you training, it has offered mentorship, and it will be giving you grants to support your enterprises. The Ibile Youth Academy, which focuses on building leadership skills, civic responsibility, and entrepreneurship among young people, cuts across our 5 Ibile divisions. The Lagos State Youth Parliament is an amazing platform which encourages young people to get involved in civic activity. It helps you to embrace democratic values. It helps you to develop your leadership skills by giving you a voice in governance. They have teamed up with the Lagos State Employment Trust Fund. They have helped young entrepreneurs again to have access to funding and resources, which I believe is fantastic for fostering innovation and growth.
And finally, from the governor's office platform, the Lagos State Governor, Mr. Babajide Sanwo-Olu, at the recently held mid-term review of the pathway to malaria pre-elimination in Lagos, has identified collective support, commitment from major stakeholders, and the need to strengthen partnership among local and international stakeholders to tackle malaria. Mr. Governor submitted that the review is of strategic importance to prefer active solutions to check the devastating effect of malaria.
Today's review is a critical step in making that ambition a reality and ensuring that we'll have a lasting impact. Since it was launched, we have been committed to using evidence, using technology, and ensuring that collaborative efforts work. And one of the main reasons we're also here is community ownership. We cannot tackle malaria just by focusing on clinics. It is essential for households, each and every one of us, and communities to take steps, right steps, by eliminating breeding sites, by getting tested quickly, and by having faith in our health system. We believe that our strategy hinges on effective communication, strong network of community health workers, and collaboration with our traditional leaders, all of our market groups, in all of our schools and places of learning. We need to work the message of prevention and testing into every aspect of life in Lagos. WHO, the Bill and Melinda Gates Foundation, the National Malaria Elimination Program, the Maisha Met, the Society for Family Health,
all of our private health professionals and practitioners, our pharmacies, our hospitals, and our community providers. Your collective support is absolutely vital. The state appreciates your expertise, your resources, and your readiness to innovate along with us. Let us therefore strengthen this partnership and ensure that the lessons we learn in Lagos will help guide our national efforts and the work of all of our other states. To the Ministry of Health, we certainly cannot be thanking ourselves. Under the able leadership of Professor Akian, to all of our colleagues in LASHMA, IHV, the great work on how far you have come. But we all need to keep up the momentum. This is not the time to clap yet.
And that's the picture from the Governor's Office platform on the City of Lagos TV show on TV Nigeria. Thanks for watching. Welcome to Lagos Agencies in Focus. Today on Lagos Agencies in Focus platform, we're proud to present to you a special one-on-one interview with the Permanent Secretary of the Lagos State Health Management Agency, LASHMA, Dr. Mrs. Emanuela Zamba. It was quite expository, talking about the major policy initiatives, efforts, and achievements of LASHMA in recent times. Enjoy it. You're still watching the City of Lagos TV show on TV Nigeria. Welcome to another very interesting segment or package of the Lagos Agencies in Focus, designed and intended to promote, project, and of course celebrate the very unique success story, achievements in terms of policy formulation, programs, projects, efforts to deliver on the Things Plus agenda of Governor Babajide Sanwo-Olu. Today we're going to be looking at health management. And of course, in any society or city like Lagos, the government of the day has been able to come up with very strategic, creative efforts to deliver quality health services. It's not really all about delivering policies or making policies. It's about implementation of these policies. And very key is management. There is a strategic agency that is saddled with its responsibility, Lagos State Health Management Agency, LASHMA. Interestingly, we have the Permanent Secretary of the agency, talking about Dr. Zamba Olutoyin Emanuela. Madam, you're welcome. It's a pleasure to have you on the program.
Thank you.
Let's just start from the basics. And the basic is, what is the mandate, the vision and mission statement, and of course the core values of LASHMA? It's very important we start up with that basic question.
So essentially, LASHMA represents the state's commitment to achieving universal health coverage, largely through the vehicle of health insurance. So what the mandate of the agency is essentially is to ensure that all residents of Lagos State, regardless of your socioeconomic status or where you come from, as long as you live, work, and breathe Lagos air, you are entitled to affordable and quality healthcare when you come under the social health insurance scheme being run by government. In terms of what our vision is, we want to be able to achieve universal health coverage, which means that everybody has an access to some benefit package, everybody in Lagos State, regardless. Our mission is to ensure that through health insurance, we deliver affordable and quality healthcare to people, and we are also able to ensure that they are financially protected from, the kind of financial catastrophes when somebody suddenly takes ill in your family, and you're now running around to look for money, and families actually do get impoverished from that. So that is something that the agency is frontally addressing. Our core values are an acronym we call TIPI. So there's transparency, there's innovation, there's passion, there's equity, and there's empathy. Those are the things that we stand on in terms of how we deliver our services here.
Thank you very much. Now, health is a major pillar in Governor Babajide Sanwo-Olu's Themes Plus agenda. And so, as an agency saddled with providing quality health care, what is actually the agency's strategic health master plan? Because you must have a master plan in order for you to achieve your set objectives for Lagosians and the sector in general.
The principles of health insurance, we're looking at ensuring that everybody has access, be it geographical, financial, physical, you have access to affordable healthcare. Affordability in terms of equity, so whether you are a rich man, poor man, beggar man, whatever, as long as you are in Lagos State, you're entitled to the same type of services that someone that is, more blessed economically than you has access to. We're also looking to see how we can sustain what we start. So it's not one of the programs that, you run into and suddenly it comes crashing down. So that is also something that is embedded into what we're doing to ensure that this is here and it is here to stay.
LASHMA has initiated a robust, all-encompassing health insurance program. So what's the scope of the scheme?
Essentially, the scheme seeks to ensure that people have access to a bevy of primary healthcare services, which a lot of thought and work has gone into that. Scientifically, looking at our disease burden, what are the things people usually go to hospital for. So we have a bouquet of primary healthcare services that everybody has access to. We also have, on top of that, some secondary and some tertiary services. So for instance, you go into the hospital, normal, we have malaria, have body pain, those kind of things, general consultation, they're covered under the scheme. We go a step further, we can admit you for up to 15 days, and you're entitled to a meal a day. We are very big on maternal and child health, whether it's antenatal, your delivery, be it cesarean or normal delivery, it is covered by the scheme. Postnatal care is also covered. All the childhood illnesses largely are covered under the scheme, and your baby is entitled to care, neonatal care up to 28 days after that baby is born. We handle chronic diseases or hypertension, diabetes. We have a lot of sickle cell warriors on the scheme. We have systemic lupus erythematosus and so on. We do have some surgeries, minor and intermediate. So we do appendectomies, herniorrhaphies. We recently added some eye surgeries like cataract and pterygium. That is also something that we handle under the scheme. We also, of course, give you glasses. We're not talking about the Christian Dior, but something that is functional, and you'll be able to improve your eyesight. We also have dental care, whether it's you want to extract or you want to fill or even you want to do scaling and polishing, it is covered. Laboratory tests, diagnostic tests, all those are covered under the scheme. We recently launched, Mr. Governor launched the standard JARA plan. The scheme has evolved over time in terms of the benefit packages, and we added what we call JARA on top of it. So it's now called the standard JARA plan. And what is this JARA about? You are entitled to cancer care. You're entitled to an annual wellness. You can have your annual wellness checked up, but you have to be on the scheme for up to your second year before you can access that. You also have things to do with dialysis. Of course, there are some terms and conditions attached to all of this. We are the first in Nigeria to integrate telemedicine into the plan. So once you come on board, you are able to either through using our toll-free line or downloading the app for the telemedicine, or even walking into one of our virtual booths, you can access care. So there's quite a lot packaged into the standard JARA plan that is generally that is like our basic minimum plan in Lagos State. We have what we call a seniors plan, because we do know that we have quite elderly also need care. So for their plan, there's things like cancer screening, things that affect the elderly more. Their plan is kind of tilted towards their own needs. We have plans for school children. So if you're in primary or secondary, If you're in tertiary, we also have a plan for you. Seniors plan, you can come mommy and daddy. So it's just a couple's plan. We continue to improve on that. We are working towards having something for people that live in the diaspora, for instance. And these are things that will be rolling out in the coming year.
From what you've said, it's more like a lot of a combo package. It's so robust. Now, how do you monitor effectively the implementation of these services? Or what do you have any feedback mechanism to ascertain the level of impact this robust scheme is actually offering?
Well, the first thing I'll say is that we're very big on data. So we are entirely ICT enabled from end to end of our entire value chain. We depend on technology. So we're able to have our data at our hand to be able to take decisions as I'm going to. We have a call center which is 24 hours. We have people that take shifts. So once you call in on our toll-free lines, you have somebody speak to you to walk you through what you need to do. We also have agents spread across all the village divisions of Lagos State and our kiosks, where you can walk in to make inquiries, you can get your plans. In terms of the services that are rendered, we work with both public and private hospitals. In fact, we have more private than public. And we do have, they are also on our IT platform. So we're able to see, for instance, the diseases that are being treated. We're able to see the demographics of the people that walk into the facilities. We're able to see how many people have delivered babies, how many malaria cases we have seen, and so on and so forth. We are also able to get feedback from our customers in real time, either when you're in the hospital and you have an issue, you have a chatbot on our website, you can call us through WhatsApp, and so on and so forth. So there are various modalities for you to give us feedback. And that also helps us to ensure that we are providing the service that you require. Some of the feedback that we got, for instance, is what helped us to expand the package to say, these are some of the things that we see people now need and have been needing. And these are things that we should add on to the plan. So we are constantly examining what we are doing and ensuring that we are proactive and trying to meet the mandates that has been given to us.
Okay, so PS, can you tell us what are the toll-free lines and the very reliable social media platforms people can easily get across?
Thank you. So we have 2 toll-free lines that, as I said, we have people behind those lines 24 hours of every day. The first one is the 0800 Ilera Eco, which is 0800 453 72356. The second number is 0800 Ask Lashma, which is 0800 27 55 27462. We are very vibrant on social media. We are on Twitter, Instagram, Facebook, TikTok. We are also on YouTube, Ilera Eco TV. Our website is www.lashma.com.
That brings me to the issue of collaboration and synergy with both local and international organizations, and of course non-governmental organizations as well. So what is the nature of the collaboration and synergy with these stakeholders, and to what extent has it actually impacted on your success?
We're very big on private sector participation and intersectoral collaboration. So, for instance, in government, we are working very closely with agencies such as WAPA, who is also in the social protection arm, having some of our vulnerables trained on skills to help them to now start earning money, and then we don't need to pay for them anymore moving forward. We are working with LASRA, for instance. So we are able to pull your LASRA ID when you come and register with us, and they are also able to help us with registering. So that is a partnership in progress. We also can use the LASRA card when you walk into the facility to use that as an identity card for you to access your care. We're also working with LASODA, so we do care for the people living with disabilities. Many of them are also under the scheme and so on. In terms of the international community, we have partners such as Farm Access Foundation. We had very good partnership with USAID until recently when that was made defunct. We're also working with Global Fund. There are quite a lot of partners within that space that we do work with that have helped us in various ways to augment and amplify what we do. So it is something that it is one of our principles here. You must leverage on partnerships to help you. It's scale. You can't do it yourself. You need to leverage on what exists to move yourself forward.
All right, thank you very much. Well, in case you just joined us, we've been speaking with the Permanent Secretary of the Lagos State Health Management Agency, LASHMA. P.S., to what extent can we say, because Lagos is a cosmopolitan city with a population wave growing every day, and there's always the issue of pressure on the health infrastructure. How is LASHMA coping? Is there any effective proactive measures to withstand the pressure?
Well, the first thing was that we were very intentional about not just working with public facilities. We want to work with private facilities so that we can diversify and ensure that we have about 3,000 facilities in Lagos State. Try and get as many of them on board so that we are not stretched in terms of the choices that people have to go and access care. So that's one way that we are helping the health infrastructure. The way health insurance is structured is that money follows the patient to the facility. So the more enrollees you have, the more money comes into your facility. It is like a predictable financing for you. And so once you are on the scheme, you are able to pay your workers' salaries. It is something that, come hell or high water, whether that patient walks in or not, the agency will pay you an amount for that customer every month. So it's predictable financing, and that helps. We've seen a lot of our hospitals develop, even improve on their quality and their infrastructure going forward, simply because their enrollee base is growing. So that's one way that we also help. We've also helped because we know that we have the JAPA syndrome, that human resources is a challenge, not just in Lagos. And that is one of the major reasons why we ventured into telemedicine. So telemedicine helps to take off the pressure on the hospitals. You can sit in the comfort of your home or your office and make a call and speak to a doctor online, who will now walk you through whatever you need to do. And you can now take your prescription and have that filled at a pharmacy. So we are not having so many people walking into the hospital for things that could be sorted out via telemedicine. And that is an experiment that we've seen that has helped as well.
Quality health care actually requires adequate funding. So how well and how far has the Governor Babajide Sanwo-Olu government provided the required funds to sustain the LASHMA project?
I would describe Mr. Babajide Sanwo-Olu, our dear governor, as Mr. Talk and Do. He says he's going to do it, he does it. Since he started the administration, he has shown commitment to this advancement of universal health coverage. We started off by him supporting bringing on board our public servants. So the premium that public servants pays, the government pays 75% of that premium, and then 25% is deducted from the salaries of public servants. That money has continued to be paid by Mr. Governor from the minute we started this in July of 2020 until this very moment as I speak. So our public servants and their families on the scheme, is in short, let's say he's sponsoring us because he's paying 75%. We're about a population of about 330,000 and counting. That is if you look at the public servants plus their families. And that is something that he has committed to and still continues to. On the part of when it comes to how do we care for the vulnerables, because of course there are people in Lagos that cannot pay for themselves. Not only has he made the 1% Consolidated Revenue Fund a first line charge, which means that that is the first of its kind by any governor in Nigeria. The money comes out in clockwork. He has also expanded the amount from 1 billion, which we got last year, to 3 billion this year, which enables us to be able to cover a lot more people. He gave us approval to be able to cover pensioners. That is pensioners that have come out from even before he became governor. And we have a total of about 30,000 or 30-something thousand of them. He gave us approval to be able to cover those pensioners for free for a year. He also went ahead when we had all these economic issues to start the palliative program which is a program for mothers where they are able to have their deliveries and cesarean sections provided for by government. That is also something that is being funded through the agency. Not only that, with his approval, we also established what we call the Domestic and Sexual Violence Fund, which is a fund that is set aside and managed by LASHMA for all our domestic and sexual violence victims in Lagos State. He also gave an approval for us to increase the premium for our providers, saying that because of the economy, and we know that they also have, there's a cost of care for them as well, that we should step up the amount that is being paid to providers. And that was done from, I believe, August or September of last year. That has been rolling with clockwork.
Now, let's look at challenges, because despite all these good stories, achievements and success stories, there are possible challenges LASHMA is still facing. What are these challenges, and how or what effort are you making to mitigate against them?
The first challenge I would mention is to do with the fact that people do not understand the concept of insurance. They feel that it is like when they ask you to go and write your will, and maybe you are willing death. So buying insurance is also like willing ill health to your family. It's a cultural thing, and it is something that, it's a behavioral sort of mindset, and it needs to be changed. That is one of the hardest things to do, and it is a journey. From where we started in 2020 to now, awareness has grown. We have seen quite a few converts, and we continue to see converts as we go along. So it's something that the agency has been very intentional, knowing that creating public awareness, sensitizing people to understand the importance and the benefits of health insurance is a medium to long-term investment. It is something that you have to keep at it, and as you keep at it, and people come in and they're able to propagate this story to others, it would eventually create a wave, and a change in terms of our behavior. The other one I'll talk about is, of course, people tend to look at things from government with a little bit of a side eye. But we have been very intentional in building the brand of Ilera Eco to show that it is something that is trusted, it is something that is here for you. Another one would be people's ability to pay. So the economy has not been friendly. Affordability is relative. So even though a premium for a year for the entire package is 15,000, some people will tell you, why is it not 5,000? It is a challenge for some people in terms of affordability. Then we also have a challenge with the informal sector, who are people that earn their money on the daily. That's why we have introduced like the flexible payments. You can pay monthly, quarterly, half yearly as you go. So it's like a pay, but you must continue that payment for you to continue to get access to care.
Now, PS, to sustain your goals and aspirations, the agency will require adequately trained, proficient workforce. So let's look at your human capacity program for your team. To what extent are they living up to international best practices?
I would say that LASHMA has a bit of luck in the fact that it does have the ability to be able to employ those that are required. As we all know, health insurance is not really a mainstream public service, and it is a very highly technical field, so to speak. So we have a blend of public servants and people that have been engaged to come and serve the purpose in here. So in terms of we headhunt, we ensure that we get the best of the best in here. We make bold to say that our own retinue of staff can compete favorably with any private HMO in Lagos State. I can extend it to Ghana. We were recently in Indonesia, and we could see that Lagos State is on the right track. Totally.
The health sector in Lagos, we can say, has witnessed a revolutionary transformation through this agency under your able leadership as the permanent secretary. So what would you count as your legacies as this administration winds down?
I would first of all, want to appreciate Mr. Governor for having the trust to bring me here to lead the charge for universal health coverage in Lagos State because it's a pioneer initiative. So I would say that my legacies are relatively legion, actually, in terms of we've been able to grow the portfolio. We're now at 1,333,000,000 people and counting. We've been able to evolve our standard plan from where it was when we started to the standard JARA, introduce telemedicine, which is something that is the first of its kind. You'll recall that we also had the EcoTelemed during COVID, which was the first state-owned telemedicine platform where we provided care for non-COVID illnesses. We have been able to introduce like a drug access expansion program so that you don't only have to get your drugs in the hospital. For instance, if the hospital for some misfortune doesn't have your drugs, you are able to walk into a participating community pharmacy and pick up your drug free of charge. That is also an innovation that hasn't been done anywhere. And it's one of our babies that we're proud of. We've also brought on board, apart from launching the standard JARA last year, we've been able to bring on board virtual booths, which is the first of its kind also. And the virtual booths serve as a stopgap for people in the informal sector. When we got to the marketplaces, what we were told was that we can't leave our store. If we leave this store, we'll not make money and we'll go and sit in the hospital the whole day. We like this thing, well, how can you bring it to us? And so the virtual booth was born. It sits in the market. There's a health worker in there. You can go in there, have your blood checks and things done, and you'll be able to consult with the telemedicine doctor, get your drugs, and go back to your store. So it's not everything that you have to go to the hospital except you are referred. So that's one of the initiatives that we are very proud of. We started the Lirantiwa Cooperative, which is a cooperative that is largely for the informal sector. Because what we realized was when we were doing the Pay Small Small, it was an initiative we started, there was attrition. People would pay once they get the service they want, they won't come back and pay. They won't complete their payments. So we started the cooperative whereby once you join that cooperative, they pay us upfront. So we are sitting pretty and we are able to continue giving your care. There are added values. You have access to loans. You can get farm produce at a cheaper price. They do some free tickets and things like that. It's a whole package of value add for the informal sector, and that portfolio is growing. We started the Ilera Eco Academy, where we train people on how to market social health insurance, because it is not a skill, it is new, and we have learned on the job, so to speak. So who better to impart if we want to expand our agent portfolio and get as many people in for as possible. So we use that portfolio, the platform, to train other people. We've trained about 588 people so far, and we'll continue to grow that number as we go along.
You've done so much, and I know you still have so much to offer. So in terms of broadening the horizon of healthcare infrastructure delivery in Lagos, what are the new ideas? What are the progressive future plans?
Well, one of the things I'd say is that I believe that health insurance can help to change the landscape of primary healthcare in Lagos State. It can be a veritable vehicle to revitalize the primary healthcare system, and it is something that we are working on very intensely with the permanent secretaries that superintend the health districts across the state to see how this initiative can help in providing predictable financing, and that PHCs can, compete even with the private sector. So another initiative I'll talk about that I think that, is something that is in the offing is to how to successfully blend public and private health provision in a way that there isn't too much of a dichotomy or too much of a difference in terms of what you get in the public and what you get in the private, because health insurance provides a level playing field for you, regardless of whether you're public or private. And because there are quality standards of what everybody's supposed to keep to, it helps to standardize and make it not much differentiation.
Let's look at the process or steps of registration. What does it entail, really?
We have various modalities of registry. You can walk into one of our kiosks. You can make the phone call our line. You can go on our website and self-register. You can use a USSD code. What are we going to ask you when you want to register? We just want to know your name, a little bit of your biodata. Tell us who your dependents are. Are you married? And we have the biodata of your wife or your husband. Do you have children? How many children do you have? What are their ages? You upload your picture. Immediately it will give you a registration number, LSHS, and your numbers would follow. And that is unique to you throughout the scheme. It would ask you, of course, you would have to give us your phone number, and that phone number is also a sort of unique ID for you throughout the scheme. So we expect that that is the number you continue to use, even if you're coming to renew. You can come in as an individual. You can come in as a family of 4, which is a husband or wife and 2 children under the age of 23. That is a family of 4. Or we have single parents with 3 children under the age of 23. Likewise, if it's a family of 6, you can be a couple with 4 children or a single parent with 5 children. And of course, you have the modality to be able to add on additional children or dependents as you go along. Once you've done that, then you select your facility. There is a list of hospitals. We currently have about 656 hospitals and counting. And you pick either public or private. It's your choice entirely. You select your hospital. And once you've done that, you make your payments. We have channels for payment. We do not collect cash. It is a zero cash policy because we don't want issues of fraud. So you use our channels. I would also like to say that people should not transfer into personal accounts.
Have you been dealing with the challenge of fraud cases?
We have had a few. We track you, and yes, you will spill the money. But once it is something that has been done in our name to a large extent, we will try to be as accountable as possible. But we do send these messages out. Don't pay cash. Don't transfer it to accounts. And once you've made your payment through our channels, we have QuickTeller, we have Pay Arena, we have T-Bills, and so on and so forth. I mentioned POS as well. You can make those payments. And once you've done that, you are now eligible to start accessing care from the 8th of the subsequent month, as long as you make your payments on or before the 25th of the existing month.
Okay, what is obtainable in foreign countries when you talk about universal health coverage and social health insurance? We also see that there's this synergy with insurance companies and the banks. What do we have here?
We have essentially almost similar. We have some banks partnering with us to also sell health insurance. Some of them are partnering with us to have like a bundled product that will be sold. So we have banks like Sterling, GTB is also coming on board, First Bank. We have quite a few of those working with us. We are also working with what they call fintechs. They also help us to propagate the gospel of Oyedepo. The way we are positioned. Yes, we do have insurance companies also. But Tangerine, we have quite a few of them that are working with us. So, you can provide it as a bundled product or you can sell it as an add-on. And we continue to expand that portfolio as we grow.
It's been a wonderful time speaking with you. So on a final note, what's your word of assurance, encouragement, and expectations from all critical stakeholders, partners, sponsors, and of course, your people, Lagosians?
Just to reassure us all that the Oyedepo program is very well thought out. It is here and it is here to stay. It will only continue to improve. And of course, the vision is that it will rival anything anywhere else in the world. So it has been built in a way that it is a brand on its own that people should trust in. Come on board. Get onto the train of Oyedepo. We have testimonials that we even put out on our social media platforms. With just your shikini money, there is services. And that is the beauty of social health insurance. Partners, we appreciate all the support and we continue to be available. As I said, innovation is very key to keep the mission of social health insurance going. So we are always open to partnerships from any, whether it is within government or outside government or international partners, to see how we can all come together and move this train forward. So Lagos residents, please join the Oyedepo train. It is for you and it would help your family to have a quality life.
Dr. Emanuela Zamba, any final word for Mr. Governor?
Mr. Governor has been the backbone of this agency. He has not only given support verbally, morally, he has done it financially. He has created an enabling environment for Lashma to have wings and fly. We are actually like the flagship for social health insurance in Nigeria, just because we have a listening and supportive governor, and we appreciate him for the support.
It's been a wonderful time speaking with you. Wish you all the best. Lagosians are looking forward to improved or better services. So far, it's been a game changer. I mean, in the health infrastructure, especially when you talk about universal health coverage and social health insurance. You've done beautifully well. Thank you very much for speaking with us. Lashma Lagos is a template other states must take note of and ride on their creative and strategic policy initiatives to deliver quality healthcare for the citizenry. The City of Lagos TV show will continue in a moment. Stay tuned. The energetic vibrancy of the City of Lagos makes it a city to be reckoned with. Until we come your way again next week, think Lagos and love Lagos. Thanks for watching.